Welcome to this edition of Silver Sneakers Boom Muscle. I'm going to do a somewhat different video today. About 5 days ago, I was just doing some jumping jacks and felt a little twinge of pain in my right knee. Wasn't very high impact, but it certainly was not a zero impact activity. 70 years old, I know I have some osteoarthritis in both of my knees. I've torn a meniscus in my left knee previously, probably 15 years ago. It's been diagnosed with an MRI, and I haven't done anything about it yet because it generally doesn't bother me much unless I'm doing like a twisting activity. So I was going to discuss a little bit of first aid and evaluation of knee injury. So if you look at my knee now, you notice there's a scar along the top. That's because I ruptured my quadricep tendon about 7 or 8 years ago, and it had to be reattached surgically. So the knee right now, you can see it's not particularly swollen. There's no black and blue. If I push on it, not much pain anywhere. The knee's a pretty susceptible joint. We put it through a lot of stress and require a lot of our knee during our life. So it's fairly easy to have some injury to the knee, whether you're doing your sport like pickleball or even just like golf, hiking, going up and down stairs. A little slip, just about anything can cause an injury to the knee. When you have an acute knee injury, the first thing you should do is get off of it. Sit down and rest a couple minutes, let your adrenaline calm down, and then do a quick assessment of the knee. First you want to look for, is there any external injury, like a cut or abrasion, scrape? Initially, the knee won't swell up right away. It takes a little while. So you can do some self-assessment to let you decide what might be going on. Say you're out hiking, you twist the knee as you're going downhill, and you get some pain, and you want to decide, can you finish your hike or should you maybe call for help? So when you look at the knee, let's say you're sitting down, can you straighten it? And can you bend it in flexion? And how far? So when I first did this, I couldn't fully extend, and you can see I still can't fully extend, maybe 10 or 15 degrees less. And flexion, I couldn't get past 90, and now I can do a little bit more than 90. You can assess where the kneecap is. The kneecap's off to the side. You might have dislocated it. Now that can be quite painful, and you won't be able to walk as long as it's dislocated. So a first aid measure I've taught is if you can bring your foot back, try and get it in a little bit of flexion, put some pressure on the side of the kneecap, and then extend and push the kneecap over, you might be able to put it back into place. If you're successful, you immediately notice the pain's much less, and the knee can actually start to move. At this point, I would continue my assessment, decide what other injuries I might have. You can feel along the joint line. Does it hurt if you push? Both on top and below the patella. Can you feel the tendons, or does there seem to be a gap? You can push the knee inward a little bit. Does that hurt? Outward a little bit. Try and bring your knee forward. Does Does it feel strong and stable, or is it kind of mushy? And then backwards. Same thing. So at this point, let's say you decide, well, the knee feels pretty stable. My kneecap wasn't dislocated. Next thing, if you can, you want to try and put some ice on it. The knee swells up pretty quickly. If it's inside the knee, it's called an effusion. That can cause pain and limit mobility of the knee. If it's external, let's say you've torn one of the ligaments along the side, you'll see some swelling on the outside of the knee. So to try and minimize that, you could put a compression wrap on, not too tight, just enough, like an ACE wrap or something. Try and put ice on it, and some sort of mechanism to stabilize the knee if you're going to try and continue your hike. If you happen to be carrying a knee brace in your backpack, probably that. Otherwise, some first aid measure using tape or ACE wraps to maybe put a stick or a hiking pole along the side of your leg so you at least can continue down. I think it's always important to get a professional evaluation of the knee really as soon as possible with your primary care provider or through urgent care. Often they'll do an assessment of the knee, kind of like what you did, more detailed and more professional, and then probably get an x-ray. You can get an internal fracture of the knee, which doesn't show up like most fractures, you know, with immediately deformity, swelling, black and blue. A little compression of the tibia usually is what happens. You get a little interarticular fracture. It might be little, but it can be significant, so it's important to get that diagnosed. After you've had a knee injury, you want to continue to rest the knee, avoid any impact. If you can walk on it, you can do some walking, but I wouldn't do very much. Continue with the compression, ice, maybe several times a day. Elevation, if you can, above heart level. And be patient. For me, I have a hard time not exercising, so while I'll still try and get a workout, I'm going to limit it to using activities where I can sit, like on one of the upper body exercise machines, or where I'm pretty sure that I can be stable and not put extra stress on my leg. So I'm going to demonstrate some exercises. You can start to rehabilitate the knee and get the muscles around the knee as strong as possible, maybe before needing a orthopedic procedure. I've hitched up a band here and wanted to demonstrate a few things first. First, while sitting, let's come to the side. I'm going to do just a straight leg raise with my leg extended, well, my knee extended as the best I can. Again, still not a full straight. And just lift up. You can lift with your toe pointed straight up or out to the side. You can do these sitting or laying down, like on your bed. You don't have to do a full range of motion in the hip. I like to put my hand over the muscles on the inside of my knee, make sure they're working. That's what we call the straight leg raise. If you can get some bend in the knee, you can go from a bent position towards straight. This is knee extension. Initially I would do this with just the weight of my foot, not adding anything extra to it. If it hurts, you want to stop. Maybe not do as many repetitions. But if you're doing okay, then same thing. I like to feel the muscles in my quads, make sure they're working. If you're doing well with that, I'd like to do some isometric hamstring. And my leg is extended, and I just tighten up the back muscles. Hold it for a few seconds. Relax. And if you can bend the knee, you can do the same thing, isometric. Again, it's always good to have these exercises under the directions of a physical therapist or rehab specialist. But again, they are going to want you to do these on your own 2 or 3 times a day. As you progress, and the knee's not hurting as much, you can try and do what I call an assisted box squat. So I have a platform here. It's pretty high. So when I sit down, my knee is no more than 90 degrees bent. I have my band up here, and then we just stand up and sit down. I think it's important to pay attention to where your feet are. I like them about shoulder width apart, slightly turned out. As you do the exercise, you want to make sure your knee doesn't collapse in and collapse out, but just stays right over your foot. As things are improving, you can just go back to a box squat without the assistance of the band. And then go to a squat where you go somewhat deeper. Again, if you can bring your knee that's injured past 90 degrees of flexion, you could try a deeper box squat. Then I have the band close by in case I need help getting up. And the progression is to go without the band. And the next progression is to not fully take your weight off on the box, but just touch it lightly and then go back up. My next progression would be to do a wall sit where you're sitting against a platform. I think it's again a good idea to have a band or some other device to help if you need help getting up. You can work your way down on this with your feet out. Again, trying to get your knee to that 90 degrees. And just sit there for a period of time. It can be pretty painful on the quadricep, but if you're having pain in the knee, you should probably hold off on that one. Next, I would go to some balance exercise. So just stand on your leg and lift your knee up. Try and hold this position for 10 to 20 seconds. To progress, you can put your knee out to the side. You can close your eyes. Bring your arms up. Rotate your head one side to the other. Increases the difficulties quite a bit. Next, I'd like to do a one leg deadlift, they call it. I do it initially with no weight. So with my leg next to a platform or chair, weight on the outside, bend forward. If you can, try and balance without touching the support, but always have it close by. This actually exercises both sides. On the support leg, you'll feel it quite a bit in your glutes as you balance. And then as you're extending your hip, you're exercising the posterior muscles as well. As with many of our exercises, you want to avoid getting your head lower than your heart, so just come to horizontal on that one. Additional exercises you can do for the legs while you're rehabbing your knee are just seated calf raises. You can put a little bit of pressure with your hands to increase the intensity. And then a standing calf raise. You can progress these going one leg at a time. In my case, it's been about 5 days since I tweaked my knee. I've increased range of motion. It's much less painful. Although if I try and do any significant cardio, either an elliptical, treadmill, or even walking up and down hills, it starts to hurt quite a bit. So I have to hold off on that for now. Just going to limit myself to walking, not going very far, just trying to get in a few minutes a day or so. I certainly can do exercises with my upper body and my core. I would recommend not doing floor exercises just because getting up off the floor with an injured knee can be problematic. Like in my case, I have this support. You can do your abdominal exercises like crunches on a support, a couch, a platform, something else where getting up doesn't put so much risk to your knee. I'm scheduled to see orthopedic surgeon in a month. Probably would get an MRI after that to kind of know the extent of damage in the knee. And if I need arthroscopic surgery to repair it or remove that damaged part, that would probably be scheduled at 2 to 3 months after the MRI. So that's why I think it's important, since that's several months from the time of your injury to where you might get a procedure or definitive treatment, to try and continue with exercise, try and increase the muscularity around the knee, which would hopefully improve recovery and minimize complications. Now, not every meniscus injury needs to have a surgery, an arthroscopic removal or whatever. Like with my left knee, I've gone many years, 15 years or more, without anything, although in some respects it does impair what I can do if I'm particularly like trying to throw a discus or something, which I enjoy. So that's why I might have that one addressed as well. My hope has always been that some scientist will come along with a procedure that helps the meniscus regrow and gets back to normal. Hasn't happened yet. Some people recommend different supplements, dietary changes to reduce inflammation. That's all hopeful, and might work. Don't really know if it does or doesn't. I hope you've enjoyed this video, and wish me a speedy recovery, and I hope you don't suffer the same problems. Thank you.